Okay, hi, my name is Kayla Reeder, and I'm going to be doing a head-to-toe assessment on my patient today, my husband, Joe Reeder. We have already gone over an extensive health history with him and done a Snellen eye chart to test for visual acuity. So, Joe, I'm just going to be doing a head-to-toe assessment. I'll give you prompts, and if you have any questions or concerns as we go along, please feel free to ask. I'll do my best to explain everything as we go along. So I'm going to have you actually, if it's okay, take your glasses off. I'll set them just to the side. Perfect, we've already tested your vision, so I'll set those over there. Okay, to start off with, I'm going to be testing your cranial nerves. So the first thing we'll do is I'll have you close your eyes and occlude one side of your nose, please. I'm going to ask you what you smell.
Like a flowery smell.
Flowery smell. Great, and I'll have you close the other nostril with your eyes closed. And what do you smell?
Like a citrus smell.
Citrus smell. Great. Okay, I'll have you open your eyes again. We've already done the Snellen eye chart, so we'll go ahead and test your eyes. I'm going to test the range of motion of your eyes, so I'll have you look straight ahead at me. And I'm going to actually have you turn this way just for a minute, if you would. We'll have you, perfect. Okay, stare straight ahead at me. I'm going to have you follow the tip of my light, if you would, please, without moving your head, just your eyes. Great. Perfect. Okay, I'm going to have you look straight ahead at me, and I'm going to test Perla on your eyes. I'm going to shine this bright light on your eyes. I'm testing that they're equal, reactive to light, and accommodating. Perfect. Okay, have you raise your eyebrows for me, puff out your cheeks. Perfect. I'm now going to take an object. I'll have you close your eyes for me, and I want you to tell me as I touch your extremities if you feel sharp or dull sensation.
Dull. Oh, sharp. Dull. Sharp. Dull. Sharp. Sharp.
Great, thank you. You can go ahead and open your eyes. I'm going to have you bite down really hard. Okay, lift up, bite down. Any pain when you do that? Great. I'll have you smile, frown, scrunch your face up like you're angry. Perfect. Thank you. I'm now going to test your hearing. I'm going to whisper into your ear. You can leave your eyes open for this, and you'll just repeat back to me what you hear.
I am strong.
Great. Thank you.
I am healthy.
Great. Perfect. Thank you. I'm now going to assess your mouth. I'm going to have you open nice and wide. I'm looking at the condition of your mucous membranes. I'm noticing the condition of your teeth and gums. I'll have you stick your tongue straight out for me, side to side. Say ah.
Ah.
Great. I'll have you, I would now check his gag reflex. And I'm going to have you just take a sip of water, if you would, please. So I watch you swallow. Okay. I'm going to have you do one more as I feel your trachea here. Okay. Thank you very much. I'm going to have you raise your shoulders. Perfect, and down, and then turn your head against my face. Okay, and other side. Okay, great. Or against my hands, I mean. Sorry. Great, thank you very much. I am now going to have you, we'll test some of your balance. I'll have you rotate your hands rapidly on your, great, faster, faster. Perfect, and then you can stop. I'm going to again have you close your eyes. Put your hands in front of you, palms out, and I want you to tell me what I'm drawing in your hand.
5.
Perfect.
B.
Perfect, thank you. While your eyes are still closed, I'm going to put an object in one of your hands. I want you to close it and tell me what you feel.
It's a battery.
Thank you. And with the other hand, please.
It's a key.
Great. Thank you so much. You can go ahead and open your eyes now. And if you would, please stand straight up. Perfect. I'm going to have you put your arms out, and I'll have you close your eyes. Great. I would also like you to now open your eyes and put your hands down. And with one heel, run along the side of your shins. Great. We're testing for balance here as well. Perfect. I'll have you take a couple steps forward as I assess your gait and your stride and your balance. Great. That's good. Will you come back to me on your heels? And now your toes. Perfect. Okay. Thank you. While you're standing, I'm going to go ahead and assess your thoracic and spine. Any pain as I press down on your spine along the back? Great. I'm noticing that everything looks symmetric and feels even on both sides. Have you bend over just a little bit? Great. And now I'm testing for CVA tenderness. Any tenderness when I do that? Okay. Perfect. I can go ahead and have you sit down. I'm going to assess the skin. I want to look for the condition of the skin, any abnormalities. I want to make sure it's intact and that his coloring and hair distribution, everything like that throughout all over his body, and I'll be doing that as I go along. We'll start with the scalp, and I'll just make sure that I'll note the condition of the scalp and the hair and the distribution and the face. I've already assessed his vision, so I'll look at the sclera. I'll note any redness or jaundice, any abnormalities. His eyes are even and appropriately apart. Look at his tear ducts and his eyelashes and eyebrows, and those look good. I'll now assess his ears. I'm going to look at the outside and compare them to one another, that they're even. I'll feel the outside of his ears, note any drainage or discharge that I see, and then if I had the proper tools, I would try to visualize the eardrum. I'm looking for a pearly grayish color when I see the eardrum. Next, I'm going to be looking at his nose, and it feels centered. I'm going to look for patency, noting any discharge or any abnormalities there, particularly of any deviation of the septum. We've done a mouth assessment and assessed his jaw. So now I would assess his neck. I assessed his trachea and that while he swallowed. I'm going to go ahead and palpate his lymph nodes and assess for any tenderness there. I'm also going to, while we're here, listen for any bruits of the carotid. So I can listen on each side, and I can also palpate the carotid, again only doing one side at a time. Perfect. Okay, now we'll go to his extremities. I want to assess the strength of his extremities, so I'll have you put your hands straight out, pull up against my hands, okay, and pull down, pull out. Great, and now I'm going to feel for his pulses. I'm going to note the warmth of his skin and the color. Okay, have you squeeze my hands. Good, and release. Perfect. I'll test for capillary refill. I can also at this time test his reflexes on both sides. Let's see, and yeah, everything checks out so far. So I can go ahead and go to his lower extremities.
Do you need this side of reflex?
And again, we're going to we would do both sides, but I'm going to look for any edema, note the color of his feet. I'm going to have you slip your shoes off if you would. I'm going to check his pulses, feeling from side to side, and making sure that they're even. I'm going to check his cap refill on his feet and note the warmth of his skin. And then I could also test his patellar and Achilles reflexes. I'll have you wiggle your toes for me. Okay, pull your feet up against my hands. Any pain in your calves when you do that? Okay, and they go down on their own. I don't know any clawiness either. I've already assessed his gait and his balance of his lower extremities. So now we'll go to, again, the thoracic. I've looked and everything, I've already noted that everything looked symmetric. I'm noting his work of breathing, any breath sounds that I can hear without a stethoscope, and I don't hear any. I'm going to listen listen to his heart. So I'll go to the second intercostal space. I'll listen for the aortic, pulmonic, herbs, tricuspid, and mitral sounds of his heart, noting any abnormalities. I'm also going to listen to his lungs, so I'll have you take a deep breath in and out, in and out. I want clear and equal breath sounds throughout. Gonna have you sit forward. Gonna go ahead and listen to your lungs. I'll have you sit straight and breathe in and out. And I'm listening from side to side, listening for, again, those clear, equal breath sounds. Great. I'm gonna do a whisper pectriloquy test, and I'll have you whisper 1, 2, 3. Okay, I'm gonna have you say the words 99.
99.
Great. And I don't want that to be clear, or it could indicate condensation. And then say E.
E.
Great. Okay. Perfect. After I'm done listening to his heart and lungs, again with his heart, I've done some checks on him already, noting his cap refill and any edema, the color of his skin, and function of his extremities, which lets me know he's doing pretty good cardiovascular wise. So now, if you would, I'll have you lay down. I'm going to do an abdominal assessment. First, I would expose your belly, and then I'm going to look, listen, and feel. So as you lay supine, I'm going to note any abnormalities of your abdomen. I'll have you empty your bladder, and then I'm going to go ahead and listen to the 4 quadrants of your abdomen, noting your any sounds. I'm going to classify them as hyper, hypo, or active. I can also listen to the aorta at this time as well. If my scope of practice permitted me, at this time I would percuss, and I'm particularly at the liver and spleen, percuss those spots and any suspicious spots that I see on his belly. And then I would go ahead with a light palpation, and I'm going to ask you to notify me if there's any pain as I softly, in a circular motion, palpate in the 9 regions of your abdomen. If I know any masses, I would want to acknowledge that as well. Everything is soft and non-tender.
Non-tender.
Okay, so then I would go for a deeper, more thorough palpation using both my hands and noting any masses. Relax your belly. There we go. Relax. Great, and then also making sure you can feel the liver and the spleen. Let's see. I'll have you again come sit up for me in your chair. Ask you if you have any questions or concerns. Anything else you'd like to talk about?
Nothing.
Okay. All right. Well, thanks for letting me do an assessment on you, and I think that's all I have for now.